Today, we have Dr. Sujeet Jha with us. He is Director of the Institute of Endocrinology, Diabetes and Metabolism at Max Healthcare. He has over 15 years of experience from his clinical practice to pioneering India's first diabetes educators training program. Dr. Jha has also been felicitated with the Best Researcher and Innovation Award by the Indian Academy of Diabetes. In his early days with HealthifyMe, he played the important role of being an advisor to the business. Hello, doctor.
Yeah,
Thank
hello.
you so much for being with us today. Jumping right into the subject of today's chat with you, increasingly evidence is emerging that obesity-related conditions like diabetes and hypertension seem to worsen the effects of COVID-19. So we wanted to engage you in conversation about the link between these two things and help viewers understand how obesity-related conditions can be managed and improved during COVID-19 with the help of apps like HealthifyMe. So jumping right into the questions, we would like to understand how should someone who is obese and obese with conditions like diabetes take care during the COVID-19 season? Could you share your thoughts with us, please?
Sure. So thanks for having me. I must say that the evidence has been there for years about the diabetes and obesity in regards to any disease and any illnesses. Unfortunately, we have to wait for COVID-19 to increase the knowledge of general populations, and the COVID-19 has been blamed to diabetes and obesity and hypertension and cardiovascular disease. Believe me, this was there in 1960s, 70s, 80s, 90s. So the obesity always been causing increased risk of heart attack, strokes, and severe infection and higher death rate in the hospital. So there has been always a link. So when the COVID-19 came in, it did say that, the older people, definitely yes, but the younger people in America, Italy, including our country, is suffering from more severe infection. And that's the problem. And they tend to do bad in the hospital. They are more ventilated in the hospital. So that's one reason. And especially in America, the Asian and Black Africa Caribbean people suffering from diabetes, a younger population, including in India. And that's what the link has been. And we as endocrinologists are not surprised about that what we are getting, because diabetes and obesity is increased, in simple words, more chances of clot in the blood, make more risk of having heart attack and stroke. And when the COVID infection comes in, unfortunately, it makes it worse. So we're not surprised. And unfortunately, we have to wait for COVID-19 to come to understand the epidemic of obesity and the disadvantage of obesity.
Right. Yeah, I definitely agree that this is certainly an eye-opening time for all of us. This surely sounds like the wake-up call that all of us need. So coming to, since you mentioned that this has always been around, what is the importance of diet and exercise when you look at a lifestyle intervention to manage the situation during this time and beyond? Could you talk a little bit about that, please?
Yeah. Brinda, the question has been, what do we do? I almost get an everyday WhatsApp message. Shall we start X, Y, Z, vitamin C, zinc? And we think that immunity can be solved overnight. So I start having some XYZ medications thrown around, marketed by different companies, and say, look, I'm going to improve my immunity, I'll have less of an infection. Unfortunately, immunity is a long-standing process, and you need to build up your immunity over the long period of time. And that in the huge implications is what's your diet and exercise, and what's your weight. So if you try to say, look, overnight, I'm going to improve my diet and start eating healthy overnight from 10th of March till 10th of May, it's not going to improve a lot. So you need to have a long-standing battle against the disease process, including COVID-19. So if you want to build up your immunity, one of the factors is eat healthy. Okay, and the question is, we all know what eat healthy. The question is, you need supervisions via digital applications, which can guide you through almost like a daily basis. And so that we can understand that not simply by losing weight by some extra diet and eating some odd diet will not help the weight loss, but will not improve the immunity. So it's very important. I say that three things are important. What's your weight? Yes, it will come down gradually. It will not come suddenly. It's very important to look after your weight. What you eat is also important. if you can't handle your weight, let's suppose your weight movements excess body weight, I understand as an endocrinologist or specialist, we understand it's not easy to bring it down. You need to have support which can gradually bring the diet, with the diet you can bring it down. Now, if you eat healthy and your weight remains fine or gradually coming down, don't get disheartened. You must eat healthy. And by healthy eating, you bring the weight down, not by any drastic method or trying to bring weight down by some short-term measures, persistent, consistent by a process. Currently, thankfully, in HealthifyMe is one of the best applications I know, which started almost 10 years ago. It's one of the applications which guide you in a scientific manner. Otherwise, you see it every day, WhatsApp message, this diet, XYZ diet. But that's very important. And then how much you exercise. You must cut down your weight, eat healthy consistently, and exercise 30 minutes a day. If you want to overnight understand and improve the immunity booster like medications, nothing is available in the market, not there possible scientifically. We're not aware of that science. What we understand that you have to be consistent, persistent all throughout your life and get on to something, very smart applications like HealthifyMe, which can help you to gradually bring your weight down, and diet at the same time prevent from the COVID-19. Not simply COVID-19 would walk in and go, hopefully it will disappear in our life, but other disease remains. Diabetes, cardiovascular disease, obesity related, so many incidents, including cancer remains. We need to fight that as well.
Yeah, that's perfect. And I think that given the time that we're in, we're all being kept in our houses, and it's a difficult situation, but that also presents a great opportunity for us to get on a slightly more healthier track and to be more aware of our health. And you mentioned the importance of like vitamin C and zinc, and eating a healthy diet. So one of the philosophies around which HealthifyMe, the app, is built is calorie counting. Could you talk a little bit about what exactly calorie counting is, and how does a calorie deficit work in helping you manage your weight and then potentially being more resistant to a disease like COVID-19?
So, everything is about calories, and everything about how do we eat that calories. If I go to space, I can have a bar which can give you 1,000 calories. I can live and survive on it. But is that healthy? That's the question. How do we eat that 1,000 or 1,500 calories? It's very important. So the whole thing is about that, to cut down the calories. Now, the major concept in diet, we since fail to understand that what we can't digest, we should eat more. Okay? So I'll tell you one example, that if you eat a kilo of palak every day, or vegetables every day, it'll hardly give you any calories. We can't extract calories from those vegetables as much as a cow can. So to understand that if you have to eat, you can't, best thing is not to eat. The question is, what do you eat? So eat something which has got high fiber content, which will not, you as humans will not give you calories much more, because we can't digest everything. So the whole fundamental of diet is more about the fiber content in the diet, so that you don't get large amount of calories, especially in obese people. I'm really talking about in excess body weight people. I'm not talking about normal people. If you want to cut down the calories, you need to have high fiber diet, which you can't digest, so that it doesn't give you calories. And simply a high fiber diet will also improve your cholesterol, prevent diabetes, good for your blood pressure, good for your cancer. So it's very important to understand that complexities of the diet. And that's why you need a bit of scientific advice from a dietitian team, by expert, guided by doctors, supervised by a consultant like us, so that we get a scientific advice. And if you follow that, it helps you to have calorie reductions in a scientific manner. You can say, look, I'm going to eat 400 calories, but what are you going to eat? It should be healthy, balanced diet, and combinations of multivitamins in diet built in. I always say that, the Genghis Khan or Aurangzeb didn't have multivitamin popping in. They had, what I'm trying to say, at ancient times, people were healthier. And if you eat healthy diet, it will give you vitamin C. It will give you B complex. You don't have to pop in a lot of multivitamin tablets to boost your immunity or balance your diet. If your diet is balanced, you'll get all the B complex, B12, including zinc, within the diet system. And we have balanced diet, ancient diet, that what we Indians eat, but that needs to be mixed up with so many things and processing of food, which has led into obesity, that what we are facing. So most The problem is high fiber diet, and once you process the food, what do? We throw the fibers out. So that's what the balance needs to be looked into. And that's why you need a professional advice and continuous feedback that what you have eaten last night and what you're going to eat tomorrow should have a balanced mix of diet, not simply the fiber, but also the multivitamins that what you need to get, including vitamin C. It's also been, I'm not sure that you take vitamin C supplementations and you have a poor diet that will improve the immunity. I do not think so. You need to have a balance of diet, exercise, weight, which will help you in the long term to improve your immunity.
And I think the point you mentioned about seeking a professional help is the best way to go about it, because anyone is willing to offer diet advice and anyone can tell you to get on a exercise track. But if you have pre-existing conditions, would you guide against more casual advice and guide people towards professionals who are more familiar in the matter and can help you through your diet and fitness?
So, I live in Gurgaon, and I do also get directly advice from my friends and neighbor, and we tend to follow, somebody is still looking, they start advising you. So I always say that, it's a very scientific. What may work for her, she may have tried, or he may have tried something differently and may not be the right balanced diet. And every day there's a newspaper, every day there's a WhatsApp, what to lose. There are so much, I would say, not very scientific programs in the market which will misguide you. The question is, the best basis of the HealthifyMe is a scientific way of the diet. And there is a scientific way of how to lose weight. So for example, if you want to prevent diabetes, 7% weight loss is required. And what you eat, need to do it. If I'm a street smart dietitian, I'll make you lose weight 1 kilograms in a week's time, and then you can gain weight. But the question is, are you eating a smart diet as well? So it's very important to understand that it needs to be continuously supervised. Obviously, not person-to-person contact, not possible. It's better through digitally application, which has been developed over years together, and finally a product which is involving AI, involving several aspects of the diet, which will help in this and across the globe to improve the diet and ultimately improve the immunity and prevent diabetes, hypertension, and other obesity-related diseases.
Yeah, well, these solutions are definitely being built at HealthifyMe, and we're singing the same songs. So it's great to hear that that's something that you support. And coming to just some closing thoughts from you, I think it's an overwhelming period and people are worried. And do you have any advice for anyone who's trying to get started on their fitness journey and may face certain hurdles during this time? And what words of caution would you have when someone is trying to take their fitness a little bit more seriously during this time?
We all understand what precautions for the COVID-19 we should take it, but much sure that you go for an exercise, make sure you wash your hand, come back, wash your hand, face mask. And if you are running in a place which is completely clean and nobody is interacting, you can move the face mask out, because if you're going to run, it's very difficult to face mask. I would say that once you started your journey of exercising, with the face mask, you may have difficulty in breathing. So be careful, start walking first and start jogging and running if you have been doing in the past. With the face mask, you may have difficulty. But it's important to continue exercise to a limit, which you can do with a face mask. If you're in a crowded place, if you are not allowed to take the face mask off, that's a technical difficulty, that's what we have, then you don't have a choice. That's about the starting exercise. But make sure, washing hand, I can tell you one thing, if somebody sneezes right in front of you within 6 feet distance and you keep touching something and keep into your mouth and keep rubbing it, then you will get the infection. Now we all know about it, but hand washing, face mask, when you go outside, important. But I personally feel like be sensible when you take the face mask off, because people are become very super sensitive as well. Even if people see from 10 meters distance and if your face mask off, somebody will come and tell you. So be careful about it. And if you have privilege to having a private and place where nobody's around, and that's the best way of doing exercise. Now, in regards to diet, there's nothing called a crash diet. Do it gradually. I would say that the last 4 months' time, last 70 days, most people have gained a couple of kilograms. Almost the whole country has gained a couple of kilograms. I can see in my clinical practice that people have gained. Docs up, lockdown with weight, but that sort of stuff is so common. And believe me or not, that now we don't know how much lockdown is going to happen. The good thing about the lockdown that we're not eating outside. We're eating homemade food, which is good for us. We're not eating takeaways a lot, which is good for us. So very important that we're almost being forced. And we Indians have inbuilt good diet, sabji, dal, all that stuff, which is good, that we can follow. So it's better to follow what is good for your diet, high fiber diet, more vegetables, more fruits, and continue walk and exercise, and be consistent, persistent. Don't do it overnight on today and forget about tomorrow. You need to follow yourself. I must give you one bit of advice. If you're not able to lose weight, but if you eat healthy and walk healthy, you prevent diabetes. You also prevent several infections, including COVID-19. If you gradually lose weight, that's fine. Slow the weight loss, but consistently is long-term better for you. Don't try to expect any applications, any dietitian, the world's best dietitian, to make you lose 10 kilograms over 1 month, and that makes you happy. We want slow weight loss over a period of time, scientific. I keep repeating this word, scientifically, digitally supervised. So applications like HealthifyMe would guide you through. And it's very important to follow consistently. Just don't eat for a month. It's not going to help you. Use it for the long term, please.
Yeah, I think that's very valid advice. It's very easy to starve yourself or eat unhealthily and reach your weight goals. But using a HealthifyMe approach with a well planned out diet plan with calorie counting, macro balance seems to be the best way to go about it. So thank you so much. And it was very informative. I enjoyed the session, and I certainly took away a lot of learnings from this. So thank you for being with us, Doctor.
Thank you. Thank you.